Christine, thank you. Dear friends, I guess everyone is really interested in the plan of the renovating Ukraine after the consequences of war. So it's my greatest pleasure to invite the first Deputy Minister of Ministry of Health, Serhiy Dobrov. Thank you. Dear colleagues, I'm very sorry. There are some changes to the agenda and the timing has changed. So very briefly, I'm going to talk about the recovery of Ukraine after Russian aggression. And then we will have a coffee break after that. So, of course, it's a pity. I need to say that almost 1,500 of sites of healthcare facilities were ruined and damaged due to Russian aggression. 193 healthcare facilities were totally damaged and cannot be restored. And this number is growing every day. And the day before yesterday, there was in Kherson, the center of emergency care was hit. The personnel was not wounded, but the building itself was destroyed. And very often we have to state that a lot of them are damaged. 755 pharmacies were destroyed, and the regions that suffered the most were the most healthcare facilities were destroyed as Kiev, Chernihiv, Donetsk, Luhansk, Kherson, and Kharkiv regions or oblast. And of course, damaged by Russians. Healthcare facilities damaged by Russians. Of course, the majority of them are on temporarily occupied territories. Some of them are on deoccupied. And of course, we continue to do what we can, but of course, it's a lot of time. It takes a lot of time and resources, medical infrastructure and transport. Each fifth ambulance was destroyed or stolen by Russian aggressors. And here we are very much thankful to our partners because they provide support and help to us since the very beginning of large-scale operation. More than 3,000 of ambulances were provided to the civil and military medical infrastructure. And of course, there is a lot of damage, which is billions of dollars, more than $16 billion damage. And we are talking about medical infrastructure. And using this opportunity, I would like to thank the World Health Organization that is assessing the resources of our healthcare system in Ukraine and continues to do that, including deoccupied territories, Hirams project that is going on. And now the next phase is being launched. And of course, we have the priorities when we talk about the renovation or restoration of healthcare system. And of course, number one priority is primary healthcare system. I will talk more about that a little bit later on. And you know that we have the capacity network developed in the most regions of Ukraine. This capacity network has already been formed, and all the efforts of MOH were aimed to the restoration and strengthening the capacities and potential of the healthcare facilities that are part of that network, cluster and supracluster healthcare facilities. Mental health services and rehabilitation services is a huge problem. None of the countries would be ready, is not ready, and would not be ready to respond to such challenges, to provide healthcare in those directions that usually we don't need so much of that in the peaceful times. Of course, we have the concept of developing the rehabilitation centers in Ukraine, and all the plans have been approved, and all oblast military administrations have approved that. Each cluster, healthcare cluster, has to have at least 30 rehabilitation beds, and new rehabilitation centers are being built and created and established. And according to estimates, more than 7,000 rehabilitation beds is something that Ukraine needs. So this was the calculation of Israeli model. So also we need rehabilitation staff, and of course, physiotherapists, occupational therapists, speech therapists are very much required. And here we need support from our international partners who help to train specialists, to train our staff. Shelters, organization, and reforms to emergency care is also another important priority to restore our country and restore the healthcare. We have a huge support from the whole world. So one of the project is Unity. Is the total cost of this project is about 500 million of euros, and there are eligibility criteria for healthcare facilities. More than 200 of those were already selected and included. And of course, the distance from the active combat areas should be at least 100 kilometers to establish them. Deoccupied territories and primary health care, of course, so those territories that were liberated, they have all their infrastructure destroyed, and our model of healthcare provision and restoration is based on using the ambulance teams, and they provide not only emergency care but primary health care as well in deoccupied regions.
Speaking of some temporary solutions, and there we also are grateful to our international partners for the initiative associated with installation of modular temporary primary care units and health posts in Kharkiv, Dnipropetrovsk, Donetsk, Kherson Oblast, and elsewhere, which provides us with enhanced capacity to rely on the network of such health posts and primary care units to provide accessibility of care to a greater scale of local population. Recovery of destroyed healthcare facilities. One of the examples you can see here in the screen, and this is a primary care facility from Kyiv Oblast, but totally 421 such facilities have been recovered fully, and 423 have been repaired. 827 healthcare facilities are still in the waiting list, particularly those which are located in the occupied territories. Here on the right, you can see the pictures of some facilities which have been destroyed, as well as the pictures after recovery and transformation. Most importantly, these facilities are functioning already. And to finish with my presentation, I would like also to express our appreciation to all civilized countries of the world, those who stand side by side with us and who help us in recovery of our patients as well as recovery of our infrastructure. Because indeed, there is always light coming after the dark. And with that, we invite and encourage all of our friends to stay strong next to us until the victory comes. And we also share the glory together with our friends and partners. Thank you so much, His Excellency, First Deputy Minister of Health of Ukraine, Mr. Dubrov. And with that, my dear colleagues, as Mr. Sergei has announced, we are happy to invite all of you, our esteemed delegates, to enjoy a small coffee break, following which we will be also happy to welcome you back to this conference hall to continue with our conference. With that, let us all have a peaceful morning.